Queen Elizabeth Hospital in Gateshead is home to the Jubilee Day Unit, a modern facility for the treatment of patients requiring transfusions, infusions and other day case treatments. However, things may have looked fine on the surface, but behind the scenes, staff were struggling to manage patient appointments and get patients booked onto the IT system in real time. This was resulting in backlogs of work, missed admissions and loss of income, as clinical coding could not be done. More importantly, it created serious issues around patient safety and experience. A key aspect of this was that the unit used a paper diary. Both nursing and admin staff made appointments, and the diary could end up anywhere on the unit, so a lot of time was wasted looking for it. Our project involved implementing an electronic diary. This was colour-coded to indicate groups of treatments and also time-defined, using information from the clinical staff about expected duration of treatments. There was no budget for this work to be done. Improvements were made only using what was already available. As Outlook was available across the hospital, this was used as a starting point to develop a new system. An improvement event was held to bring together clinical and administrative staff to examine the current process and redesign a new one. This resulted in clinical staff no longer booking appointments, enabling them to focus on patients. Admin staff were given management of the diary. Appointments were booked into the IT system in advance, enabling coding to pick up that episode. The diary was standardised so that it could be replicated in other parts of the hospital. These diaries can be shared by other units to help the flow of patients and information. Currently, the electronic diary has been rolled out from the Jubilee Day unit to the Procedure Investigation unit, Endoscopy and the Chemotherapy Day unit, encouraging collaborative working. The electronic diary has enabled us to measure how much of the capacity of the unit is currently being utilised for the first time. We can see at a glance how busy the unit is and if there is potential to maximise its use by diverting patients from other places here for routine treatments. This is freeing up time and space in other areas of the hospital while getting the best value from the day unit facility. And this has reduced the amount of missed admissions from this one ward from 38 in July to 1 in October.
Basically, we used to use a paper diary and we used to have to write down individual appointments, but when patients got here there was sometimes a long wait, whereas now the electronic diaries let us put in patients in a particular time slot in a chair, so there's no waits for patients when they come in now. It's really been a great success.